Today we will be showcasing the 10 oddest dental cases ever. Unfortunately, that's not like ordinary dental cases. Aside from plaque, dentists have found some extremely odd things in the mouths of their patients, like the presence of hair to larvae. So stay connected in order from least likely to make you sick to your stomach to the worst of the worst. Now let's begin with our number 10. Dental wire in the mouth. A dental case of an Australian woman who was gone to the hospital complaining of abdominal pain. After a CT scan, doctors found a piece of metal that tied to a cord that had pierced her small intestine. The crazy part of the story? The woman had been stripped of her shackles 10 years earlier. Doctors believe she had swallowed part of the wire, and it had been sitting in her stomach for years before moving into her small intestine. Oops! Number 9. Superglue in the mouth. For 10 years, a woman in England took the DIY method and used superglue whenever one of her teeth came out because she was afraid of the dentist. Toxic glue caused severe bone loss in her upper jaw, and she eventually had to have several of her teeth removed and replaced with dentures. If you suffer from dental phobia, reach out to a good and friendly dental clinic to help you feel as comfortable as possible, so you don't have to go to extremes to save your teeth. Number 8. Gum garden in the mouth. Do you ever think to grow a garden inside your mouth? Imagine what it would look like. We have got a real case of a dentist who found tomato seeds implanted in a patient's gums during a root canal. Upon closer inspection, the seeds actually sprouted. Crazy! Number 7. Severe calculus in the mouth. This is really about negligence. Calculus, also known as tartar, is a form of hardened dental plaque. Dental plaque is required to be cleaned or picked away daily by the patient through their oral hygiene routine or by the dentist during regular dental cleaning. If plaque is left on the teeth, it hardens over time and forms a hardened calculus. We would suggest brushing your teeth at least 2 times a day. Number 6. Mold in the mouth. Dentures can be replaced by those who have lost their teeth and are designed to be extracted daily for special dental hygiene. Surprisingly, one patient here in Arizona did not remove the dentures for more than a year. When he visited the dentist, there was a black and white mold growing all over his prosthesis. Yuck, talk about a health risk. Number 5. Tomato plant in the mouth. When a dentist pulled out a denture for another patient who had not removed or cleaned his prosthesis for many years, he not only noticed that mold was growing, but also found tomato seeds that had taken root and grew out of the dentures. Although we advise you to eat your vegetables, we do not recommend that you grow those vegetables in your mouth. Number 4. More teeth sets in the mouth. Hyperdontia is a rare condition of having an extra set of teeth. Extra teeth are called supernumerary teeth. They can grow in any area of the dental arc and do not fit into any specific angle or placement. This dangerous growth of extra teeth in any dental arc is not usually painful. However, extra teeth can sometimes put pressure on your jaws and gums. Pain and inflammation are often associated with hyperdontia. In addition to the filling of natural teeth, this can cause the patient's teeth to become crooked. Number 3. Larva growing in the mouth. Myiasis is a rare parasitic disease in which a patient's oral cavity becomes infected with larvae. This case is considered unusual for several reasons. One of the reasons is that the oral cavity is often unable to provide adequate habitat for the larvae to survive and thrive. Certain conditions and occurrences contribute to the patient's tendency to oral myiasis. Some of these conditions include, but are not limited to, oral hygiene, tooth decay, fungating carcinoma of buccal mucosa, patients with tetanus, severe halitosis, and facial trauma. Number 2. Presence of hair in the mouth. The rare case of having too much hair on the inside speaks for itself. There have been dental conditions where the patients feel the growth of hair in their mouths. This has concluded that the presence of hair on the inside is a side effect of reconstructive surgery. Chronic hair growth can be caused by fixed hairs that are inserted during surgery. Hair removal options need to be done every 4 to 6 weeks due to the hair growth cycle. If the laser is the preferred method of removal, the laser must be used carefully and under general anesthesia. But don't try hair removal creams for this. Number 1. 232 teeth in the mouth. I swear this is too uncomfortable to imagine having more than 32 teeth in a mouth. But this actually happened with a 17-year-old boy in India who was found to have 232 teeth due to a condition called composite odontoma, a group of dangerous tissue that could grow teeth inside them. Fortunately, the doctors were able to remove most of the implants and the patient recovered fully. Oh my goodness! Which dental case is the oddest one in your opinion? Leave a comment and check out our amazing top 10 videos popping up on the left and right sides of the screen. See ya!